Okay, can everybody see the slides? Got the slides up? Perfect. So tonight we are going to be looking at transitions into adult services. And for those who don't know me, I'm Amy. I'm the Support and Information Officer here at the TSA. If you contact the support line, it may well be me that you get through to as one of the support line team. I've been with the TSA for over a year and a half. Believe it or not, that's flown by. And we are going to talk tonight about the transitions into adult services. So we quite often hear from families on the support line about how challenging those transitions can be, sort of through paediatric to adult care in terms of hospital care, as well as social care, education. We often hear that, when people are going through the process, doctors all think about and talk about it from their perspective, so the medical side, the transition to paediatric to adult care. Education professionals think about it solely as the education side, going from school to further education or work, apprenticeships, whatever the journey might be, and the same for social care professionals. When other charities have done research into it, talking to young people, what they want is to look at it in a more holistic approach. And we know that trying to find that information yourself can be really challenging, having to pull the information from one place to another. So looking at it in a holistic way is something that we're really, really keen on doing to make it more accessible and a better process for everybody to go through. So there are some general tips for a good transition. Now, I appreciate TSC can affect everybody really differently. Some people may be very mildly affected, and so transition can look very different for them to somebody who has higher needs and needs more support. But broadly speaking, these are the tips, and hopefully you'll be able to take something away and consider it in terms of how it might look for your young person. So start talking about it early is the big thing. Ideally, transitions should begin at 14 years old, so that's year 9 in school, and it kind of coincides with the educational assessments that are going on at that time as well. It's really important that the transition process involves the young person and is centered around them, empowering them as much as possible. It is really important to think about the young person's strengths and what they consider their strengths, and what they want, what goals it is that they want for the transition, as well as the young person, the parents and carers, having discussions with them about their involvement in the process. It's also important to remember that different services have different ages where they may consider you a young person an adult. So for some it might be 16, for some it might be 18. It's not necessarily all at the same time, so it could happen at different times for different services. We are looking at creating, or we are creating a transition toolkit, which will be something that will be available to the community to download and use. It will be a way of families and young people going through all the different areas of transitions into adulthood, and looking at where they are now. So it can always be used as a working document, looking at where they are now, what they can do, what they might need more support with. So almost like a checklist. So going, yeah, I know how to do that, or actually, no, I need a bit more support with that. And that's something that can be revisited throughout the time that you're going through it. So you can go back and go, okay, yeah, now I know how to do that, as well as including lots of resources and tips and exercises that can be used throughout that. So once that is available, we will obviously put out some communication to you to let you know that it's there and ready to be used. But in the meantime, these are the sorts of things that it will be looking at. So A really important place to start is being able to talk about yourself for your young person to be able to talk about themselves. When I say talk about themselves, I know not everybody speaks, not everybody is verbal, so it's about how they communicate. Are they able to communicate their needs and what it is about them? So that might look different for different people. So on that, their preferred way of communicating, is that via speech? Is it PECS? Do they have an AAC system or use sign language, Makaton, different language? Who are the people that are important to your young person? That may well be the families and carers around them. It could be best friends, it might be a support worker, someone at school, any and all of those things. What are the things that they enjoy doing with their family or important person? What things do they like to do in their spare time? Are there things that they enjoy doing independently already? What skills do they have that they're really good at? I know that it can be really challenging to talk about what you're good at. So it might be that at first they can't think of what it is. So they might want to ask you or ask their friends or other important people, what skills is it that they are good at? What skills would they like to improve on? What would they like to develop their independence by doing? So that could be something really small to start with. Again, we're looking at 14, so that's still really young. It could be something really small, and then as they get older and you revisit it, it might be different things. So it could be making a shopping list, going all the way up to, going to the shop, spending their money, going on the bus, anything like that. And the skills and the ways they'd like to improve their independence, develop their independence, kind of feed into the next one. What are the goals that they have for the future? And that goes back to those tips for a good transition. It's having those goals around what it is that they want to do. And again, I know looking at this when you're 14, I mean, I certainly have very different goals now than when I was 14. I didn't end up doing any of the things that I thought I wanted to do when I was 14 because it changed so much. Who are the people that can support them with their goals? And another important one is, do they have any religions or beliefs that they hold that are important to them? It might be that actually your young person finds it easier to have it written down in bullet points to start with and starts off by writing it down and then progresses on to talking about it. Another important thing is talking about TSC. So can they explain how TSC affects them? Again, it might be that they want to write it down or start practicing writing it down, how it affects them, before being able to actually kind of speak to people about it. It may be that actually they're not confident in speaking about it and it's going to take some time. So there are things that they can do which you may already be aware of. We have a TSC card that can be shared with people when you're out and about, for example, as a discreet way of showing that they've got a disability and how it may affect them, a bit like the sunflower lanyard, in much the same way that signals that there's an invisible disability. Understanding how their medications might affect them. Understanding that TSC is a genetic condition and what that means. Knowing who their different professionals are. So that might be the TSC clinic, as well as other professionals, other medical professionals, social care professionals, anyone else who's involved in their life. Also knowing how to contact the TSA support line. We're here for the entire family to support them with talking about TSC. It could be talking about TSC or that they just want to have a chat about it. We sometimes have parents who call with their young people to get a bit of advice, and other times we've had young people who have come home maybe from university who need a bit of extra support, and parents give us a call, introduce them, and then hand the phone over, which is absolutely fine. The details are there. They can also be found on our website, so please do contact us. We'd be happy to provide information about TSC, chat about it, help build the confidence in talking about it by going through it over the phone. We're more than happy to do that, absolutely no problem. again, it's really important to kind of feel empowered talking about your condition, because it's something that is lifelong, and going through adulthood, it's probably going to come up a lot, be it at appointments or with friends. So talking about it early and trying to build that confidence is a really good thing. So the transitions through the adult services in terms of doctors and healthcare. Knowing where their appointments might be and who their doctors will be. Now, for some people, we know it might not change, and that's probably the lucky few who stay with their doctors, same doctors in the same clinics. But for most people going from paediatric to adult care, there will at the very least be a change in doctors, but quite often there'll be a change in clinics and to the hospital as well. Getting to know the TSC doctors and nurses and how to contact them. Again, we appreciate that change can be a huge challenge, and getting to know your doctors. There should hopefully be an overlap with most services. Most services try and introduce you to the new doctors and nurses while you're still with your paediatric doctors. That doesn't always happen, but it's always worth having that conversation if you're not sure, and asking the team that you're with currently. The other things to think about could be, how you travel to the new places. Can you do a couple of extra runs beforehand? Speaking to the hospitals, some hospitals will allow you to do a visit to a new ward. So if your young person is often admitted into hospital, the adult wards are significantly different to the children's wards, and some hospitals understand that completely and will allow a visit into an adult ward. It's also worth finding out if the hospital have a learning disability nurse and team who can help you and help facilitate these sorts of questions. That's, a part of their role is to help with these kinds of things and any reasonable adjustments that might be needed for the appointments. There's also hospital passports, which can be helpful, and you can fill in all of the information about yourself, about your young person, and take that with you to the appointments and share them with any doctors, nurses, clinicians that you might see. Another thing that we're hoping to work on here at the TSA is a TSC hospital passport, so really geared towards the needs of the TSC community, and also a hospital appointment or doctor's appointment checklist that can be used to help make those appointments a little bit easier and preparing for them a little bit easier. Again, it's not something we've got yet. It's something that we've had feedback on that will be really helpful. So we are working on it, and as soon as it's available, we will let you know. So there is the social care transition. Most local authorities will ask for children to have a transition needs assessment. So before they go up into adult care and get their adult care packages, a transition needs assessment needs to be done. We hear that this can be a really kind of scary time, but the local authority should ensure that whatever services are being provided under the children's services, that is in place throughout the assessment, and it's only once the new adult care package is in place that will then be removed. So there shouldn't be a loss of services, and hopefully that should be reassuring that you won't lose those services. Again, it's really good to know who the new social care team will be and how to contact them. It might be that your young person doesn't actually have any kind of social care or care packages in place, but as they grow up, their needs may change. So knowing what options are available to them and how to contact the local authority social care is another good one to have, as well as having that talk with the parents or carers around them about how involved they'd like them to be in their decisions about their care. And again, that might be something that changes as the older they get and the more independence they want. Which can be sometimes difficult to hear as a parent, but again, it's about having that young person in the centre of these plans. So education, Again, I know education can look really different for different people out there in the community, but they will be moving through the education system. So what are the next steps going to be? For some people, that might be further education. For others, it might not be. If they are staying in education, do they have an EHCP education healthcare plan? If not, do they need one? Education healthcare plans should go up to the age of 25. I know that local authorities can make it extremely difficult to access EHCPs, and it can be really difficult to get them. However, the law at the moment is that they can be in place up to the age of 25. And if you need support with this, there is the IAS service. Every local authority has one. They are, however, an impartial and independent service. So they offer free advice to families, and they are really good. They know all the local authority information, so specific to that local authority, as well as the SEND law. You should be able to find that by going onto the local offer. So you can type in online your county. So for me, it'd be Derbyshire IAS, and the information will come up. Excuse me, sorry, I've had a horrible cold about 3 weeks ago, and I'm still a bit hoarse when I'm talking. It might be that your young person wants to learn and find out more about apprenticeships. It might be that they want to get some career advice. Most schools are a good place to start. They have a careers advice service. If not, there are also lots online, like Barclays have an online career advice service where you can information online. There's quite a lot out there. If you want help finding that information, please do feel free to get in touch with us, and we can point you in the direction of some of those career advice resources. It might be that they'd like to volunteer. Local volunteer bureaus or volunteer services have a huge range of volunteer opportunities for people with lots of different abilities and needs. It can be a good way to find out maybe what they're interested in, or just to have something to do to fill the time that feels like they've got a purpose, which can be really, really important to our young people. Another one is knowing what reasonable adjustments can be made either in education or as they're moving out of education into employment. Also understanding what can be disclosed to employers about disability and what their rights are. If the young person is moving into employment and would like more information about that, we have got a guide for employers that we can send out, and we've had lots of good feedback on that. And there's also the Citizens Advice Bureau, who have lots of information about the rights and what you can and can't, or what you should and shouldn't share with employers about disability. Another big one to think about as you're moving through into your adulthood is money and finances. What does your young person like spending their money on? What is it? Do they have any hobbies, any collections? And then if they want to have that money to spend on these fun things, do they know how to set a budget? Do they have any idea about budgeting? Do they know about what bills they might have to pay, and if so, how to pay them? Do they receive any benefits, and do they know what they're entitled to and how to access that information, and how to get support with those applications, because those application forms can be a lot. They can be a lot of pages with a lot of words and a lot of questions. Managing money online. With the way that the high streets are going, we know that the banks on the high streets are becoming few and far between, and everything is going online. So do they know how to manage their money online? And do they know about saving money? That is something that is often not talked about. We're expected to have all these savings, but not often told how to do that, how to do the savings. A good way of starting that understanding and learning the value of money can be pocket money. And that can be for small tasks around the house, again tailored to your child's sort of abilities and needs, it needs to be something feasible for them. There's also Go Henry, which is a debit card but has parental control, so it's a good way of parents and their young people having discussions around like learning about money whilst having control over it, which is always a bonus, particularly if your young person suddenly has access to money that they haven't had before, and they can go, oh yay, let's go spend it all. My daughter, it would be on birds and cats at the moment, toys, but I give it a few years and it'll probably be real ones, no doubt about it. Another really important thing with the world that we're in today is keeping safe online. There's no escaping it. Social media is everywhere, and there are so many different platforms. It is how the majority of young people today communicate. So knowing how to keep safe from the not so pleasant people that hide behind the screens is really important. Knowing how to change your privacy settings and block someone on social media, how to report someone on social media. Understanding what trolling is, that these people behind the screens who say these horrible things are only doing it to cause pain and not because of anything that they actually know or any real value on the person. It shouldn't affect the self-worth, but it so often does. And that is exactly what these horrible people want. There are some really helpful resources online. MenCap have a guide to online and phone safety, and that's something that is designed for our young people to look at. Bullies Out have a great online safety for parents guide. They also have lots of information about what to do about bullying. We actually had an event with them at the start of the year, so if you haven't had a look at that, it might be worth going back and having a look at that and talking about bullying and how to support our children if they are being bullied. And there's lots of information on their website about cyberbullying as well, and how to recognise how our young people to recognise as well when someone maybe looks like one of our friends but isn't. Recognising online scams and email scams, and actually phone scams as well. We were talking about that today, how sophisticated they're getting, and how clever they're getting. So the importance of not sharing any personal information to scammers, potential scammers, but also anyone that might be wanting to do something not so nice. So keeping our personal safety in the forefront of our thoughts there. Knowing how to turn off location settings, that's another one. I think on all of the social media apps, but particularly ones like Snapchat, it's apparently very easy to see where someone is. So again, keeping yourself safe by knowing how to keep the location off is important. Then there's the safety when we're out and about to think about. Do we know what is considered an emergency situation? What's an emergency? What's not an emergency? And if it is an emergency, do they know what to do? Do they know who to call? So often when people ring 999, they don't then know what to do and what information that they need to give. So it's important, maybe you can practice that at home, knowing how to give the right details, so address, location. And when you're out and about, that can be really difficult. So a really good resource for that is the What 3 Words app. It's able to download, and it gives you 3 words that identify exactly where you are, and you can just give that over to the emergency call handler, and they'll be able to identify exactly where you are and get you the help as soon as possible. And just following on from that, if you're at home, if you have a landline, it's really good to make sure that your children and young people know how to use that, because it's surprising the number of children that don't know how to use a landline. I know not many people have them anymore, but for those who do, it's good to go through and show how to use it just in case of that emergency. You never quite know when you're going to need it. It's better to know it and not need it than need it and not know. So again, much like the online safety, know how to recognise a bully or somebody who may be a threat, and know who to talk to if you're being bullied, as well as having strategies to keep yourself safe when you're out and about. Again, Bullies Out have lots of helpful information on recognising somebody who might be a bully, and what you can do about it. So, on from the super serious onto fun and leisure. What are their hobbies or special interests? Do they know how to access clubs and local groups that are to do with their special interests? Do they know how to join other local groups that are more to do with social side of things, which we know is really important? I mentioned it before, there is the local authority local offer. Again, just pop it into Google. You can put in your local authority and then local offer, and it should bring up the website. That has a list of all of the things that are available in your local area for children and young people with SEND needs, including social groups and activities. Also, as well as information on things like education settings, out of school activities, all of that, that's all on there. So it's a really good thing if you haven't had a look at it before to have a look at. Helpful resources for parents to know what's in their local area. Does your young person know how to actually get in contact with their friends? They see them all the time at school, but they don't see them. Do they know how to get in contact with them and get in contact with them safely? And again, and I've said it several times, but understanding and recognising those qualities of a good friend. So they listen to you, do they make you laugh? Are they kind? Are they respectful? Are they someone you enjoy being around, rather than somebody who might not have the qualities of a good friend, somebody who maybe has qualities as a bad friend, being judgmental, making you feel bad about yourself, putting pressure on you. It's also important to remember that everybody makes mistakes. So just because someone's done something that maybe doesn't make you feel so good, if they apologise, can you accept their apology? Obviously, you don't have to, but it's good to talk about apologies and the importance of them. I know sometimes it can be easy to see things in black and white and take things very literally, especially if someone is maybe on the autistic spectrum, for example. So it's good to have those conversations around the emotional literacy side of things as well. So feelings and emotions, having an understanding of TAND, PSC associated neuropsychiatric disorders. That is something that affects 9 out of 10 people who have TSC, and it is something that can have really broad meaning. So it can be something like autism, ADHD, neurodivergence, but also the mental health side, so depression, anxiety, having those negative self-feelings, and it is so common, so common. So it's worth understanding that TAND is, again, very common within the TSC community, and they're not alone, definitely not alone in having those feelings. And following on from that, do they know how to build their self-confidence and have that feeling of confidence in themselves, and how to manage those negative self-thoughts? Some ways of doing that could be affirmations, positive qualities, so repeating them: I am strong, I am brave, I'm resilient, which can feel a little bit silly to start with when you start doing it, but it has been proven that doing that daily can help change the pathways of the thoughts in the brain. So where you would maybe jump to a negative thought to start with, by practicing affirmations, for example, you can then sort of train your brain to start thinking more positively, which then has a sort of knock-on effect with other areas of well-being. If you can improve one area, it quite often kind of filters out into other areas. There is the TSA support line that you can call if you need to talk. It's worth pointing out though that we're not crisis line. So if someone is in crisis, they should call 999 or go to the local A&E. There's also Samaritans that can be contacted 24 hours a day, 7 days a week, and they're always there to have a chat as well. There are also some other charities that are specifically for young people to support them with their mental health, which is Young Minds, and The Mix as well supports people up to the age of 25. They actually provide a free counselling service. So if you're having, or the young person is having difficulties accessing the counselling through the NHS, I know that the waiting lists are phenomenally huge at the minute and accessing them can be really challenging. They do have a free counselling service that can be accessed. They also offer support via text and online chat as well, if that's a preferred way of communicating for your young person. Sometimes picking up the phone can be really difficult, so it's good to know that there's the other ways of communicating out there. Advocating for yourself. So it comes back to that understanding TSC and how it affects them and being able to talk about that. Feeling able to prepare for appointments. So again, that could be knowing the route, having a look at the route. Do they go by bus? Are there any roadworks on the way? Do they need to allow extra time? All of those things to consider, as well as the paperwork side of things. So any questions and details of symptom changes, concerns, take notes of what they said, that kind of thing. Again, we've got it in our pipeline to look at an appointment checklist, but you can just do it on a piece of paper. You don't need a checklist. If you don't want to, you can write it all down. Do you want to take somebody with you to the appointment to support you? That is absolutely fine. And it also means that if you're at the appointment and you get a bit upset, which is really common because it can be so stressful and so worrying going to these appointments, and if you're not used to having to talk about it, it can be really nerve-wracking. So having that person there, if you do get upset, means you can hand over your list to them to talk about and they can carry on for you. But it's really important for them to remember, if they do get upset, it's absolutely fine, because at the end of the day, we're all human, and it's nothing to feel embarrassed about. Understanding their rights and understanding confidentiality. We had a talk with Renaissance Legal a little while ago, talking about understanding capacity and power of attorney. That's something that you might want to take a look at. It's a really complex subject, and certainly not something that I would feel confident talking about. So they are the experts in that. So if it is something that you want to think about and want to find out more information on, then definitely go and have a look at that. It was only a couple of months ago that we had that event. So the information on there is all reasonably up to date, and it's definitely worth seeing that, because they are, like I said, the experts in that field. General lifestyle. So that kind of covers quite a broad topic, but knowing what the healthy foods are and why it's important to eat them. We know from research that people with SEND are quite likely to become overweight, and that could be through lack of understanding or lack of accessible information around healthy foods and why it's important. So MenCap have a really great guide for people who may have additional needs, to explain what healthy food is and lifestyle, and information on kind of diet and exercise as well. of course, if you're looking at making any changes, it's probably wise to speak to your GP or your clinician before making any of those changes, just in case it's going to have an effect on any of the symptoms on medication. Following on from that is knowing how to actually access the food. So doing a food shop, either in the shop or online, knowing about what exercises they can do and what they enjoy, and why exercise is important. So we've kind of covered contacting the medical professionals, but there's also things like the dentist and how to order medication collection prescriptions. Knowing how TSC can affect sleep and how to manage feeling tired. We've got lots of information about that on the website, and the Sleep Charity also have lots of really helpful tips around managing sleep and how to help achieve a really good sleep hygiene routine. As our young people get older, it may be that they are out at university or just out there in the world, and there are the influences of drinking, smoking, and taking drugs. So it's important to understand what effect that might have on medication, particularly for those taking medication for epilepsy, for example, as well as sort of the social effects of that. Does your young person know how to manage their periods, if they're a person who has periods? What period products are sensory friendly for them, and how to access them. And the last one that we've got on here is understanding safe sex and how to access sexual health services. Contact run a event that they host online around talking about sex with young people and children with learning difficulties and disabilities. And whilst it's not always something that we're comfortable with talking about, it's really important to know how to talk about it, for our young people to understand what's appropriate and what's not appropriate in terms of what they may want to do with other people, but also what other people do to them in terms of keeping them safe as well. So if that's something that you feel you might want further information on, then definitely have that easily accessible to families. So the things to remember, I appreciate there's a lot to consider, and it's kind of been a bit of a whistle-stop tour, but you're not alone. There's lots of people out there who are ready to be that listening ear and who want to help, and that's us included. Starting early to talk about these things from the age of 14 is what's recommended. Keeping it person-centred and empowering for the young person. We appreciate that it's probably really daunting, not only for the young person, but for you as parents and carers, but also it's really exciting kind of going into that adulthood, all these new doors that could potentially be opened for your young person. So keeping that excitement alive is also something to hold on to. And then working with your young person to meet their goals. I know we've said it lots, but it's really important to keeping the transition. If anybody does want to ask any questions or wants the links to any of the resources that I've mentioned, please do feel free to get in touch with the support line. You can either give us a call or drop us an email, and we'd be happy to go through it all. And like I said, I appreciate it was a bit of a whistle-stop tour going through it all, and lots of different areas to think about. So if there is anything that comes up, please do let us know. Thank you, Callie. Hopefully there's some positive things to take away from it, as well as just all the information. If nobody has any questions, anything further, then I will say thank you so much for coming and for listening to me cough and splutter throughout all of that. It was really great to see you all, and we'll see you at the next one.